It's a moment we all hope never to witness, but one we should all be prepared for. Sudden cardiac arrest is a serious medical emergency. It happens when the heart suddenly stops beating properly. Think of it like an electrical problem in the heart. The heart's normal rhythm becomes chaotic, and it can no longer pump blood to the brain, lungs, and other organs. This is different from a heart attack, which is more like a plumbing problem. A heart attack occurs when a blockage in an artery stops blood flow to a part of the heart muscle. A person having a heart attack is usually awake and can talk, but during cardiac arrest, the person will collapse and become unresponsive. Knowing the signs of cardiac arrest is the first step to saving a life. The signs are very clear and sudden. A person in cardiac arrest will suddenly lose consciousness and will not respond to you, even if you shout or shake them gently. They will not be breathing normally, they might not be breathing at all, or they might be taking gasping, irregular breaths. These gasps are not true breathing and are a sign that the brain is not getting enough oxygen. You will also notice that they have no pulse and show no signs of movement, coughing, or other signs of life. It's a sudden shutdown of the body's most vital functions, and it requires immediate action from anyone nearby. It is crucial to understand that a heart attack can sometimes lead to cardiac arrest. The damage to the heart muscle from a blocked artery can disrupt the heart's electrical system, causing it to stop beating effectively. However, cardiac arrest can also happen for other reasons, such as electrical abnormalities in the heart, trauma, or drowning. The key takeaway is that while they are different conditions, they are both severe medical emergencies. A heart attack is a circulation problem, while cardiac arrest is an electrical problem. Recognizing this difference helps us understand the urgency and the specific type of help that is needed in that critical moment. So, when you see someone collapse suddenly, it is vital to check for these signs immediately. Are they awake? Are they breathing? Don't waste time trying to figure out the exact cause. If someone is unresponsive and not breathing normally, you must assume it is cardiac arrest. This simple and quick assessment is your trigger to act. Hesitation can be fatal because the person's brain and other organs are being starved of oxygen with every passing second. Your quick recognition of the situation is the first, and perhaps most important, link in the chain of survival. Every person should feel empowered to make this quick check and start the process of getting help. When someone goes into cardiac arrest, the clock starts ticking immediately. The survival of that person depends entirely on how quickly they receive help. The heart has stopped pumping oxygen-rich blood to the brain. Without oxygen, brain cells begin to die within just a few minutes. After about 4 to 6 minutes without oxygen, brain damage can become permanent. After 10 minutes, the chances of survival are very, very low. This is why we call it a race against time. The actions of a bystander in those first few minutes can make the difference between life and death. You are their only hope until professional medical help arrives. Your immediate response is absolutely critical. The first thing you must do is call for emergency medical services. In the United States, that number is 911. Be clear and calm when you speak to the dispatcher. Tell them your location and that you have an unresponsive person who is not breathing. The dispatcher can provide instructions over the phone and will send paramedics right away. But while you wait for the ambulance, you cannot afford to do nothing. Those few minutes are too precious to waste. This is where cardiopulmonary resuscitation, or CPR, comes in. Starting CPR immediately can double or even triple a person's chance of survival from cardiac arrest. CPR is a life-saving technique that helps keep blood flowing to the brain and other vital organs. CPR stands for cardiopulmonary resuscitation. Cardio refers to the heart, and pulmonary refers to the lungs. When you perform CPR, you are essentially doing the work of the heart and lungs for the person. You use your hands to push down on the chest, which manually pumps the heart, forcing blood to circulate. You also breathe into the person's mouth to provide oxygen to their lungs. This action doesn't restart the heart, but it buys critical time, keeping the brain alive until an electric shock from a defibrillator can be used to restore a normal heart rhythm. Think of yourself as a bridge. You are bridging the gap between the moment the person collapses and the moment professional medical help arrives. Without that bridge, the person has almost no chance. Every push on the chest, every breath you give, is a lifeline. It is a powerful way to turn a moment of helplessness into a moment of hope. The fear of doing something wrong should not stop you. It is always better to try to perform CPR than to do nothing at all. An emergency dispatcher can even guide you through the steps over the phone. Your willingness to act is the most important factor in this life or death situation. Performing CPR might sound complicated, but it can be broken down into simple, manageable steps. Before you do anything, make sure the scene is safe for you and the person. Then check for a response. Tap the person's shoulder firmly and shout, "Are you okay?" If they do not respond, you need to act fast. Immediately call 911 or your local emergency number. If someone else is with you, tell them to call 911 and look for an automated external defibrillator, or AED. An AED is a portable device that can shock the heart back into a normal rhythm. Putting the phone on speaker mode is a great idea so the dispatcher can guide you. Once you have called for help, you need to check for breathing. Look, listen, and feel for no more than 10 seconds. Watch the chest for any movement. Listen for any sounds of breath. Feel for any air on your cheek. If the person is not breathing or is only gasping, you need to start chest compressions right away. Kneel beside the person's chest. Place the heel of one hand on the center of their chest, right between the nipples. Place your other hand on top of the first hand and interlock your fingers. Keep your arms straight and position your shoulders directly over your hands. This posture helps you use your body weight to do the compressions. Now it's time to start the compressions. Push hard and fast. You should push down at least 2 inches or 5 centimeters deep. The rate of compressions should be between 100 to 120 pushes per minute. A good way to keep this rhythm is to think of a song like "Stayin' Alive" by the Bee Gees. After 30 compressions, you will give 2 rescue breaths. Tilt the person's head back gently and lift their chin to open the airway. Pinch their nose shut, cover their mouth with yours to create a seal, and give 2 breaths, each lasting about 1 second. Watch for their chest to rise with each breath. Then, immediately go back to doing 30 chest compressions. Continue this cycle of 30 compressions and 2 breaths without stopping. It can be tiring, so if another person is present who knows CPR, you can switch roles every 2 minutes to maintain the quality of the compressions. You should only stop performing CPR if you see obvious signs of life, like the person starting to breathe on their own, or if an AED is ready to be used. You should also stop if a trained medical responder takes over, or if you become too exhausted to continue. Following these steps gives the person the best possible chance of survival until professional help arrives with more advanced equipment. Learning CPR is one of the most powerful things you can do for your family, your friends, and your community. A cardiac arrest can happen to anyone, at any time, and anywhere. It can happen at home, at work, or in a public place. In fact, most out-of-hospital cardiac arrests happen at home. This means that if someone you love suffers a cardiac arrest, you are the person most likely to be there to help them. Knowing CPR transforms you from a bystander into a first responder. It gives you the confidence and the skills to act decisively in a crisis, providing a vital lifeline when every single second is precious. The impact of bystander CPR is enormous. Statistics consistently show that when a person in cardiac arrest receives immediate CPR from someone nearby, their chances of survival can double or even triple. Think about what that means. It means more parents returning to their children, more partners returning to their loved ones, and more friends getting a second chance at life. Without CPR, the outcome is almost always tragic. By taking a few hours to learn this skill, you are equipping yourself with the ability to literally save a life. It is a profound responsibility, but also an incredible gift you can give to others. Getting trained in CPR is easier than you might think. Many organizations, such as the American Heart Association and the Red Cross, offer CPR certification courses. These courses are widely available in most communities and can often be completed in just a few hours. During the training, you will learn the proper techniques for chest compressions and rescue breaths on mannequins, and you will learn how to use an AED. The hands-on practice in a controlled environment builds muscle memory and confidence, so you will be better prepared to act effectively if a real emergency ever occurs. Some courses even offer a combination of online learning and in-person skills sessions. I want to encourage every single person reading this to consider getting certified in CPR. Do not wait for an emergency to happen to wish you had learned. Be proactive. Be prepared. The life you save could be a stranger's, or it could be someone you hold dear. By becoming trained in CPR, you join a community of everyday heroes who are ready to step up and make a difference. You become a crucial link in the chain of survival. Take the course, learn the skills, and carry that knowledge with you. You truly have the power to save a life in your hands.